Epilepsy is a neurological disorder that disrupts brain activity and causes seizures. Even though epilepsy affects about 3 million Americans, many people don't know much about it. In fact, some people with epilepsy still face stigma and discrimination built on negative misconceptions. Can you separate myth from fact? Myth: only children suffer from epilepsy. Epilepsy is a lifelong condition, and it can develop at any age. People over 65 are almost as likely to develop epilepsy as children under 10. Myth: when people have seizures, they'll convulse and faint. There are many different types of seizures. Some involve fainting and convulsing, but others just cause short periods of rapid blinking and staring into space. And some involve strange sensations like tingling, or odd behavior like lip smacking. Myth: having a seizure means you have epilepsy. If you have 2 or more seizures that appear out of the blue and occur more than 24 hours apart, you may be diagnosed with epilepsy. But things like binge drinking, sleep deprivation, concussions, or new medications can also cause seizures that aren't at all related to epilepsy. If you think you have epilepsy, talk to your doctor about getting a diagnosis. Myth: you don't need a specialist to treat epilepsy. Your primary care physician should be your first stop, but you should also consult a neurologist who has the skills, training, and experience to properly treat your epilepsy. By using Healthgrades guided physician search, it's easy to find a neurologist who's the best fit for you and your epilepsy. One of the biggest myths about epilepsy is that you could swallow or choke on your own tongue during a seizure. That's just not true. You could bite your tongue during a seizure, but it's impossible to swallow or choke on it. Myth: epilepsy treatments can't really control seizures. However, with the right medication at the right dose, about 2/3 of people with epilepsy are able to completely control their condition. And if medications don't do the trick by themselves, other treatment options can be added, like a special diet, nerve stimulation, or brain surgery. Talk to your doctor to get on the treatment path that's right for you. It's easy to find the right doctor at Healthgrades.